question at the moment. You mentioned that they will come in to make sure we have certain steps, and one of them was to have a curriculum. But I just want to make sure we write the curriculum. It's our curriculum, and they don't evaluate it in any way or make any assessments regarding it.
Right. So the standards, again, that we follow are the PA work and career standards.
Thank you.
I have a couple more questions. Some of our folks mentioned the confidentiality issue with minor children. So what are we currently doing now when a minor child, who I would guess would be most of our students, but I think more people are concerned with, an elementary age child, or maybe not. Let's just speak to minors in general, with confidentiality and counselors.
So you want to know what our position is on,
yes,
on that. So if you look at ASCA's ethical standards, they have a section about responsibilities to parents and guardians. And that's one of the things that they note in there is that they recognize that providing services to minors in a school setting requires a collaborative relationship with parents. Now, in any counseling model, school or outside of that, there are confidentiality components to that. And the purpose of that really is for the relationship between the counselor and the person that they're counseling, right? You have to build trust. And so if you're sharing information out, that gets in the way of that relationship of trust. But again, our role as educators is to follow both the federal and state mandates in regards to parents' educational rights. And so our counselors are trained to understand those rules and regulations and supply information to parents. I can speak as a former school counselor that there are oftentimes, what we're doing is encouraging our students and helping them find ways to have conversations with their parents and vice versa. We're working with parents to help them identify ways to have conversations with their students. So never is the intention to hide information or use confidentiality as a shield against parents. We're really trying to work collaboratively to help students foster positive relationships with their parents. And we are mandated reporters. We also have to follow the rules and regulations that go along with parents' educational rights. And so we do that.
Thank you. And one final question, because there seems to be some concern about ASCA being aligned with CRT and teaching our students that they are white supremacists, oppressors, inherently racist, and white privilege. So would that ever happen as a result of this training, or ever happen in a counselor-student relationship or classroom instruction relationship, even if we're teaching our own curriculum? Is this an agenda item that would be taught to our students?
It's not an agenda item, and really the intent here was to help us figure out how to better structure counselor time so that we could meet the needs of more students. A lot of the feedback, not just in the mental health audit now, but in previous years at board meetings, was that students need to know their counselors, they need to be exposed to them, they need to build relationships with them as a way of helping our students to incorporate their mental health and feel happy and successful at school. So one of the areas that we wanted to focus on was how can we reorganize those structures so that counselors have time to do that they're out in buildings, they're working in classrooms, they're working in small groups, they're able to work with students on an individual basis. And so we think there's room for improvement there in the way that we run and schedule our time. And so that's what we're really working towards.